All right, thanks for staying with us. If you just joined us, we're still live on GH1 TV. This is GH Today. It's supposed to have been myself and, of course, Mike Hincalf, but he ran away from this interview, and I'm going to be telling you why pretty shortly. So, the month of May, I believe we all remember, is supposed to be the Lupus month, the purple month. And we've been told that it is some wolf that we're fighting apparently. And so we're still working towards taming this wolf. Well, today we have an expert in the house, rheumatologist in the person of Dr. Jifat Day. Well, she's with the Kolubu Teaching Hospital and Director TRI Ghana. She's going to be telling us about the disease and what TRI stands for, what they do. Of course, we've been joined as well by some patients, people living with the disease. Petra, you're an SLE patient. And Doc, you're going to be explaining to me what SLE means later on. And Eunice as well. So you are Eunice and you're Petra. All right, Eunice, Petra, Dr. Day. Thanks for joining us.
Thank you for having us.
Doc, so you know why Kafi left? Apparently, he was diagnosed of ulcer. And according to him, you just sent him away to someone to take care of him. You didn't take care of him yourself. So he's not going to do this one with you. How about that? So it's a 1-1 draw, isn't it?
Yeah, I'm not supposed to take care of people who are too close to you. You
Ethics.
start imagining strange things and stuff. So you let someone who is detached take the decisions.
All right, so let's quickly jump into our conversation. So we're talking lupus, and lupus is supposed to be an autoimmune disease.
Yes.
First of all, explain to us what autoimmune diseases are.
So autoimmune, let me first explain the word. So auto meaning self. It comes from a Greek word meaning self. Immune is your immune system. Your immune system is your body's soldiers, so to speak. So that is what God has designed to help you to fight diseases. So now if you say self and then immune, that basically means the immune system has turned against itself. So instead of the body's soldiers going to fight foreign agents that come into the body, like malaria, your pneumonias and stuff, it decides that the certain parts of the body are foreign to it. And the way God has designed the immune system is it's supposed to be protective. So once there's a foreign agent, it will attack it until it destroys it. That's the protective mechanism. So in this case, that is seeing itself as foreign. That same mechanism is there. It will attack that part of the body that it sees as foreign to it until it destroys it. And there are several types of autoimmune disease, over 100 types of autoimmune diseases. Some are local and some are systemic. Local meaning it affects only one organ. So something like diabetes in children, it's an autoimmune disease, type 1 diabetes. Thyroid, those who get the swelling of the gland, that's a local autoimmune disease as well. But the systemic type, that means it can affect any part of the body. So from the top of the hair to the soles of your feet, any part of the body that the immune system has decided that is foreign to it, it will attack it basically.
Wow.
And lupus is a systemic autoimmune condition.
And that makes it more,
definitely more serious. Exactly. Yeah.
So let's now zero into lupus. So what is it?
So, like I just explained, it's a systemic autoimmune disease. It tends to affect females more than males. And usually females in their childbearing age, just when you think life is starting, you're about to enjoy life, then, or you're in your reproductive ages, that is when it tends to come.
Any particular reason why that it tends to affect females the most?
We think it's something hormonal, because if you look at the age range, it's usually when estrogen, the female hormone, is really around the place. There have been experiments where they've given mice in the lab estrogen, and they find that they are more likely to develop lupus-like symptoms as well. So we think it's got something to do with the hormones, but it's usually a genetic thing plus an environmental thing. Genetic as in your genes, your building blocks, the thing that makes you you, that makes me get my big ears, whatever.
Okay.
That is what God has designed as part of your immune system. Unfortunately, that normal immune system tends to be hyperactive. So you may have that gene and not have any problem throughout your life. But you go and meet the provocative factor. Sometimes that can be different things for people. Some can be stress. Some people tell you after my mother died, it was really stressful time for me. That's when the symptoms started. Some people will tell you, I had a bad infection. I was hospitalized. After that, I've never been the same again. So there are various triggers. For some people, it's just working in certain industries. The chemicals there can trigger the symptoms for them. So it's a combination of a genetic factor plus an environmental trigger. But the people likely to have it are the people where estrogen is basically
So can I, for instance, have lupus because my mum had lupus?
Okay. So we don't say it is hereditary. Hereditary
Okay.
means there's a direct inheritance. You can get it straight away, like
Indeed.
sickle cell disease.
Disease,
This
yes.
is not hereditary, even though we say it's genetic. Now, if you look around, however, because your immune system, your genetic makeup is usually the same in the family. So that's how come somebody will see you and look at your sister and say, okay, the two of you are related because your genetic makeup is basically the same. So that makes that immune system, which is
by
likely
genetic
to be
makeup, you're looking at the likeness.
the likeness, exactly.
Yes, okay.
So your building blocks, what makes you. Because it is similar, you are more likely to also, somebody else is also likely to have the immune system being hyperactive in the family. But it's not always necessarily the same type. So if you look around in the family, you find that somebody has diabetes, somebody has thyroid problem, somebody may have rheumatoid arthritis, another autoimmune, somebody may have lupus. So it's not direct that, oh, I have lupus, that means my children will get lupus. No. The chance of that is really like 1%, really low.
So in the case of Petra and Eunice, SLE
Yes.
patients,
Yes,
what is SLE?
So SLE is systemic lupus erythematosus. That's the short form of it. Most people call it lupus, or most people call it SLE for short. So like I said, it's a systemic autoimmune condition.
So that defines the lupus
itself, yes.
Let's go on to how am I able to know that I have lupus? You know, so symptoms.
The symptoms.
How are you able to identify the symptoms?
Symptoms are really varied. Because it's a systemic disease, it depends on which part of the body it affects. I'm sure if Petra and Eunice tell their story, find out that how it starts is different for different people.
Indeed.
So if it's something that is affecting the heart, you may come with chest pain, difficulty in breathing, if that's the part of the body decides to attack first. If it starts with the skin, you may come with a rash. There's a typical rash that we call the butterfly rash, which may show across the cheeks.
Butterfly rash.
A butterfly rash. So that is how come the symbol for lupus is a butterfly.
Okay.
But the same reason, that's why the symbol
And that shows around the cheek area.
across the bridge of the nose
Okay.
there. Now that's the reason why they call lupus lupus as well, because lupus means wolf. It's a Latin
Indeed.
word meaning wolf. And in the olden days, they thought it looked like the scratch mark of a wolf. So that's where the word lupus came from. Okay. Now if it's affecting the kidneys, you may wake up with swelling of the face, swelling of the feet. So it differs. But some symptoms are common across a lot of autoimmune diseases. Fatigue, extreme fatigue. You rest, but you wake up still exhausted. They'll tell you some type of fatigue I cannot describe. Joint pains, very common. Not only pains, but associated with swelling. It's different from the kind of joint pain that you get in sickle cell, which is like deep in the bone. This is across the joints. And you may see swelling across the joints as well. Skin rashes is also common. Fever, high-grade fever, especially at night, with sweating and you losing weight without making effort. If you have those combination of symptoms, then you need to try and find the cause. A lot of people will tell you, I've been treated for malaria several times, and they were not finding the cause. If you have symptoms that have been investigated for a long time, then usually you want to go and seek a specialist's opinion to see whether
Now
you can
I'm getting
find
a
the
bit
cause.
concerned because some of the symptoms that you talk about, I'm feeling the fatigue bed, the joint pain. Sometimes I do. I remember that growing up at a point or something, was it rheumatism or something like that? I used to experience that,
Yes.
but you know, it's the glory of God I can say today that I don't remember the last time that I felt that.
Anything like that.
So when you're feeling all of these pains, will I be right to want to go and check just to be sure
I mean,
that
if it's coming with a lot of symptoms, usually we give it a period of 6 weeks. If you're having some of the symptoms continuously for about 6 weeks,
okay.
then you need to go and find the cause, because there are certain things that can mimic lupus. And lupus mimics a lot of diseases.
Indeed, I
if you
heard
get
that as
malaria,
well.
you get joint pains, you get tiredness, because it's the body's reaction to infections. So if after 6 weeks, we expect usually if it's an infection, it will clear away. So if after 6 weeks it's still not going, then you need to try and seek another opinion.
Doc, I'll come back to you so we can look at managing it, because as it is, then I know that it has no cure.
It has no cure.
It has no cure. So at least for now, we know that it has no cure.
Yes.
So we'll be
we
talking
can
about
manage
managing it.
Definitely.
But let me come to you, Petra, first. When were you diagnosed, Petra? When did you know that you had lupus?
That was 2 years ago.
2 years ago. How did it happen? Share your story.
Okay. I was in school one day and I found some spots, reddish spots on my skin. So I had to go to the school clinic to go and check it out. So when I went, the doctor told me I had to see a specialist, and that is urgent. So I took exit from the school and came home to be seen at the hospital.
Did that scare you?
Yes, the doctor scared me a bit because
of the urgency
Yes.
bit that came in.
So I was very scared. I remember when he told me on my way to the hospital, I was crying throughout. But then when I got home, I was taken to the hospital and my parents spoke to me and I was relaxed. So actually it started when I got to the hospital. Yes.
How long did it take before you were diagnosed? Like doctor says, it mimics, almost every ailment. Were you first diagnosed of, say, malaria, or other diseases before they realized that it was lupus?
No, mine actually came a little straightforward because it started with the bleeding. And
You were bleeding as well?
Yes. So it continued for like a week in 37 and then I was transferred to Kolebu and it didn't stop. That was for like 1 month. So I was hospitalized for 1 month at Kolebu and they were making series of tests to confirm or to know what the problem actually was.
And I believe that you were at this point scared to death. Already you were crying on your way to the hospital. Had you now been told exactly what the issue was with you?
Yes, when I was told, I was very happy because I knew that finally I know what exactly is wrong with me.
Well,
so then I'll be okay.
Indeed, that makes a lot of sense. But let me come to you, Eunice. How did your diagnosis come about?
It started, I think I was doing my national service at the water region. So I started feeling the pains, the joint pains, then the swelling of the pains and the feet. Then I got the rash, the butterfly rash also. So at that time, I was already a patient at Kolebu, but I was diagnosed with something different. So when it happened, I went to police hospital. But when I got there, the doctor was like, no, I have to go back to Kolebu because that's where I've been going for my review. So when I got there, because of the butterfly rash and everything, I think the doctor got it. He got that, oh yes, it might be lupus. So I was transferred to the rheumatologist department where I met Dr. Day and I was diagnosed with lupus.
Wow. And like Petra, what was the feeling like when you were told that that was it?
I was scared and I was a little bit relieved also because at least you know what's going on because the pain was serious, it was bad.
Unbearable.
Yes. So at least you know what's going on, you'll have the chance to take your drugs and at least move on in life. So yeah, it was scary and it was also good. Yeah, but it was a little bit annoying though because having lupus is not an easy thing. Yeah.
I can imagine. How does that make you feel? Definitely you're not able to do the things that you used to do before.
Yes.
Doc talks about the tiredness aspect of it. And we've had a patient on set who tells us that, somebody might be sitting somewhere not knowing what is going on with you and might be branding you lazy.
Yeah.
That kind of thing. Do you get that?
Yes, I do get that. Sometimes you get tired a lot. Just doing something small, you are just tired. And you wonder, this small thing, I'm already tired. And also lupus, we are not so, the sun is it's a taboo. You can take all your drugs, but when you are not supposed to sit on the sun, because even if you are taking the drugs...
What happens when you sit on the sun?
I get, it beats me. I can feel the heat.
Wow.
Even after going up the sun for some few minutes, I can feel that my skin is, I don't know how to describe it. So sitting on the sun is a taboo. And you see people walking, sometimes I walk with an umbrella, and people look at you, and they wonder,
umbrellas it's not only for the rainy days.
Seriously.
Yeah.
So people will just be looking at you, this lady, why? But because I know what I'm trying to prevent, it doesn't really bother me much.
Doc, what is the thing with the sun?
So they get what we call photosensitivity.
Okay.
So they go out in the sun would evoke some reaction in the skin. Now, lupus is a disease. We'll go a little bit scientific now. So what happens when the
Just try
sun...
and break it down a
exactly.
little
When
for
the sun
us.
beats on the skin, it causes the cells to die. Okay. And when the cells die, then it releases the cell's components. Now, the moment the cell's components are released, remember the immune system is there looking for the foreign things. So once cells die, more foreign things are available. So the immune system goes into action again. So that's how come they get a flare.
Just
So usually
starts
it starts attacking. So when they go out in the sun, the skin is going to die. It's going to produce more foreign things for the immune system to try and attack. So usually we'll advise them to wear sunscreen to limit the amount of sun rays that go into the skin.
That is if they have to be
if
out
they have to be
there
out
at all
yes.
costs.
I mean, you cannot go out there. You have to work. You have to do stuff. So advice, usually if you know you're going to be out for a long time, wear long sleeve shirts. Make sure you are covered up a little bit. Put sunscreen on your face so that at least the rays are limited.
But if you're wearing long sleeve shirts
Yes.
in the sun as well, wouldn't you feel warm enough to
Definitely.
trigger the
So
thing that
it's
you
not
talk
really
about?
the warmth. It's mainly the rays that are penetrating it. So yes,
The
you
radioactive-
feel the
Okay.
UV rays
Yeah,
inside
ultraviolet.
exactly. So actually, even some of the UV rays are in the normal fluorescent bulbs. So even that can trigger a flare for some of them.
Okay, so they're supposed to be
careful.
mindful of that as well.
Exactly, of that
Wow.
as well.
Petra, tell me, are you bitter?
No,
You're not.
not at all.
Because there's Dr. Day taking care of you.
Yes.
Why else would you be bitter? So what? You were in school. At what level? Was it senior high? or-
Second year.
Second year, which
Ken
school?
University.
Ken UST. Have you managed to complete your
Yes, I'm
school?
a pending graduate.
Oh, okay. So you had to defer.
No, I didn't defer.
Okay.
I was
What
always
happened?
quarreling with my doctors that I won't defer, so they should discharge me. So I go and write exams.
So you managed to write exam.
Yes.
But you haven't
I
graduated.
came 3 weeks to exams, had a lot of practicals and all that, but then I had supportive friends and the lecturers were also very supportive.
I was going to
so-
ask, the kind of support, that you get from friends at school and at home. I'm sure that definitely would be a massive one.
Yeah. But in school, it was amazing.
Tell us about it. What exactly were some of the things that your friends did for you?
I'm an industrial arts student,
Okay.
so offering textiles, and
Right.
it comes with a lot of stress. And we have to do dyeing, weaving, printing, a lot of computer works and all that. And this is a situation where I've been in the hospital for like a month, so I have works piled up for me and midterms to write. So I needed people to actually help me out because they know if I was around, I'm always almost the first to present my works because I don't like late submissions. Yeah. So once I came and I had to do all those work within a short time, I actually needed a lot of help from them, and they actually helped.
It's good that you talk about how that you usually submit your works early, because then I was going to ask, didn't anybody say that you were trying to take advantage of the fact that you had been diagnosed of lupus and just neglecting your...
Far from it. Actually, it made some people look odd. Okay, because I wasn't feeling well, came back, submitted even earlier before
Most of them
some
did.
that way.
Wow.
Actually in school.
Wow. Doc, the management bit, and Eunice, you were having your national service at the time. So what next? What happened after that?
Yeah, so fortunately for me, at that time, I just completed my national service.
Okay.
So I came back home. It was time for me to search for a job, and lupus was just right there. So the challenge was there. How am I going to cope?
How difficult was it?
It was difficult. It was difficult, but you have support. I mean, from the family, from our lupus family, the support group that we have, and also from Dr. Day. So with that, yeah, it was challenging, but the support was there.
And today you have a job.
Yes, I have a job.
Great. Are you working as well? Yeah.
I'm now going to do my service.
Okay.
Yeah, I'm not even done with my project.
Okay, right, right. Listen, we wish you all the best with that one. But let's now look at managing lupus doc.
Let me just say a little bit about what they've talked about. That both of them, their story is not typical. Both of them were diagnosed quite early because their symptoms were out there. But most of the time, it takes about 3 to 4 years for patients to be diagnosed because the symptoms are so all over the place. Even in developed countries.
That long?
That's
3
long.
to 4 years?
A lot of doctors may not be aware of the symptom complex, so that's why we need a lot of education, even in the medical community, for them to have that heightened suspicion.
Indeed.
As well. And getting support, I think family support has been very good here, but we've had lots of cases where people have had a lot of problems, even in the workplaces, where they know the diagnosis, but they don't really offer any support because they just can't understand why. I mean, if you look at Petra, she's looking so well. Why can't she not get up and go and work? You say, oh, she's lazy, she's just pretending, using this sickness as a care of, basically. You know, so it can be very challenging for them. As well.
And talking about doctors not being able to, diagnose early enough, I know that there are just 2 of you.
Yes, there are only 2 of
yourself?
rheumatologists in the country currently. Yeah.
Wow.
Yeah. So it's a big challenge as well. But so that's why we need more doctors to be aware of it, so that at least the diagnosis may come to them that this is what it is, so that it doesn't take a long time. Because we have people who have been going to doctors for a long time. So last year, I have a story. Last year, we were doing our annual poetry events where we fundraise using spoken word and poetry and music to raise awareness and raise funds for our organization. And one person came to us and told us that I have a person in my workplace who looks like she has lupus from the symptoms that you've been describing. So I'm going to tell her relatives to bring her. We didn't hear anything from her again. Then 6 months later, we have a young lady admitted to our hospital, very ill, kidneys done, gone, her joints were gone, she just had affected her brain. Then somebody calls me and says, this young lady that I was speaking to you about 6 months ago, that's the young lady.
Wow.
So it was actually lupus. Unfortunately, she wasn't diagnosed. She was still seeing different doctors, and her friend forgot to go and prompt her parents that this is what he thought. Unfortunately, that young lady passed. So that's why we are so really aggressive and passionate about raising awareness, because even that information can save somebody's life. It is handled
Indeed.
carefully.
I definitely was going to talk about the awareness. Yes, because then even at your level, as doctors, there are a lot of them that lack the basic knowledge.
That cannot put the symptoms complex together, because it mimics a lot of things. Some people come with seizures. They'll be at the seizure clinic for a long, long time until somebody maybe notices that there's something else in addition to the seizures. Then you may think that it's lupus. So it's just the heightened awareness, even in the medical community, is very important.
But until this month of May, I didn't know much about lupus.
Yes. Well, there's been a recent survey in America that shows that up to 50% of the general public don't know about lupus even up to now, where they've been raising awareness. So a lot of people do not know about lupus. Even though it's likely that you know somebody who may have lupus. It's more common than sickle cell disease, HIV, or leukemia, all combined together. Lupus is more common than all those diseases combined.
Okay, let us now, as we wrap up, look at how we manage the disease. Yes.
So because the immune system is hyperactive, usually what we do is we try to suppress the immune system. So we use drugs that we call steroids, and then some immunosuppressive drugs, which some people commonly refer to as chemotherapy, to try and suppress the immune system. But the doses that we are using are not the doses that they use to treat cancer. It's just small doses to try and suppress the immune system. This brings the immune system activity down so that it's not so hyperactive. And you have to do a fine balance between making it suppress the immune system versus it being so low that the patient catches infections quickly and stuff like that. So you need to have a fine balance between the drugs. Now, the drugs can be pretty expensive.
Indeed, affordability.
Affordability is a huge factor. So the steroids are cheap, but the immunosuppressive drugs. Now, if somebody comes in a crisis, the kidney is shutting down, you need to give loading doses of steroids. You need to put them on very potent immunosuppressive drugs. Even the loading doses of steroids these days cost about 600 Ghana cedis. But that can be the difference between somebody's kidney shutting down or somebody's brain being damaged. So that is one of the reasons why we are also there with Try Ghana, to try and raise funds so that in emergency situations like that, we can help.
So that
patients.
support system, definitely it's important.
It's very important.
But how long does the patient need to be on the drug?
Now, it depends on the manifestation. So if somebody has a kidney disease, you needs to be on very potent drugs for up to 2 years.
Up to 2 years?
Up to 2 years before you even start bringing the drugs down. Wow. Now, we say it's a chronic disease, just like hypertension and diabetes or sickle cell. You know, it's because it's your immune system, it's part of it. It's not going to go away. So likely you're going to have the symptoms for a long, long time. We can treat it very well and get you into a state we call remission, where you may be off drugs or be on very minimal doses of drugs. We've had cases, a lot of cases, who are on minimal drugs or nothing at all because the disease has been controlled, the immune system has been finally managed to become...
right, and finally, can I get pregnant if I have the disease?
Yes,
how safe is it?
We advise that normally the condition has to be controlled for at least 6 months before you attempt getting pregnant. If you manage to get it controlled, you can get normal pregnancy with minimal complications. Last year we had very successful, about 6 pregnancies. This year we've had 2 successful pregnancies among our lupus patients or groups as well. So it can be done, or it can happen, but you just have to make sure that you are cooperating with your doctors and it's a planned pregnancy and not just one that you...
Doc, thank you so very much. Ladies, I believe that there are a lot of people out there watching us now that are wondering how that you're doing it, you know, just to look the way that you're looking. I know obviously thanks to Dr. Day, but just quickly in 30 seconds maximum, tell us how you've managed, you know, to look the way you're looking today.
I honor my appointment,
Okay.
doctor's appointment. Yeah.
Okay.
I take my drugs.
Okay.
I'm someone who is very prayerful, so...
Okay, so the prayer thing works as well?
Yes, it really works.
It does. Eunice, how do you do it? Quickly.
Yeah, almost the same. Prayer, changing lifestyle, eating healthy fruits and vegetables, seeing the doctor and taking my drugs.
So your faith has kept you till today. Thank you so much, ladies. Eunice, Petra, and of course Dr. Day. Thank you.
I would like to basically talk about TRI in case somebody knows the condition and wants to get in touch with us.
We'll put all your contacts out there. Yeah, we'll put all the contacts out there. So thank you very much. Dr. Jifade is wife of my King Kafui, and she is a rheumatologist, one of 2 in Ghana. And of course, lovely ladies you see here, Eunice and Petra, are living with the disease. That has been our conversation on lupus. It's still the month of May, and we're still raising the awareness. So if you've heard us, tell somebody to tell somebody about it. It's serious, and we all should come together and support, you know, people who are living with the disease. All right. So, well, we're not done yet. There's still a lot coming up. Just Upon comes up next with News Extra, so don't go away.